in Naples on a beautiful Thursday, temperature around 80 degrees. The sun is out, and I bet you that Senator Marco Rubio wishes he were here right now. Hi, Senator.
Hey, I'm on my way, though. I will be there.
I know you're going to do coffee with your constituents tomorrow at Neighbor over on Pine Ridge Road. We look forward to seeing you there.
That's right. Yeah, the weather's not nearly as nice here.
First of all, congratulations.
36 degrees.
I'm sorry to hear that.
Yeah.
I want to say congratulations. I haven't talked to you since the election, and we were very happy to be an early supporter of yours, and we're thrilled that you're in D.C. representing us here in the state of Florida. And I know you have not wasted any time since you've been in office. Voting yesterday, let's talk yesterday about the vote on health care repeal. No surprise that it went down to defeat, but were you at least somewhat hopeful that some Democrats might have crossed over on that vote?
I was, because, I mean, it's really hard not to go into Florida or, quite frankly, any state in the country and talk to job creators and not be told that this bill is killing jobs.
Yeah.
I mean, if jobs are created by everyday people from all walks of life that start a business or grow an existing business, and anywhere you talk to those people, they tell you, look, we are afraid to grow our business, or we're afraid to start a new one because we don't know what the cost of the health care bill is going to mean to us. And so there's a lot of different reasons why this bill needs to be repealed, but the one that I keep going back to, which stands on its own, is the job-killing aspect of it. Obamacare is a job killer, and that's why that bill needs to be repealed.
Now, can you tell me what provisions of the bill specifically you see that would kill jobs?
Well, there are a number of them. First of all, just the cost of it. Companies don't understand how they're going to manage this. I mean, what if I have over 25 employees? What do I have to offer them? Am I better off paying the penalty than not offering the insurance? You know, what are the reporting requirements going to be? If I, you know, should I put all my employees on part-time status? You know, if I grow my company, will I trigger any additional mandates? I mean, all of this uncertainty that it creates. And, you know, the average business person, the people who are really making our economy grow in the world of small business, I mean, they don't have time to get up in the morning and read the Wall Street Journal and the full analysis of experts on how the bill could impact them. They certainly don't have the resources to hire lawyers and accountants to help them navigate all this. Yeah. When they're faced with uncertainty, when they're faced with things like this, their response is to play cautious and say, you know what, this is not a good time to hire more people. This is not a good time to go into a new line of business, because on top of the regulations that we face and on top of the high taxes that we're paying and all the other uncertainty that exists in our economic marketplace is this health care bill that we don't fully understand what its impact is going to be, and so therefore let's wait and see. And the result is a stagnant unemployment rate.
I know that you're working as fast as you can and pedaling as furiously as you can to, you know, get up to speed with all that you have to do. But have you given any thought to what you might want to see replace this bill?
Sure. I've talked about it during the campaign. I mean, first of all, we have to acknowledge that what we have is a health insurance problem in America and the availability of it. One of the things I'd like to see is empowering the individual consumer. And the way you do that is you allow them to buy health insurance from any company in America that will sell it to them. And you also go to small businesses or associations and you say, look, why don't we're going to make it easy for you guys through the tax code to pool together. Let's say I'm a member of a board of realtors in Southeast Florida, and there's a board of realtors in Southwest Florida. Let's pool our members together and buy health insurance for our members from any company in America that will sell it to us and have the same tax benefit that employers have when they buy it for their employees. By the way, the same should be true for the individual. You know, if my employer buys health insurance for me, if your employer buys health insurance for you, they don't pay taxes on the money that they spend on their portion of the health care coverage. But if I buy it for myself, that money's 100% taxable.
Right.
So these are some examples of things. And I obviously also think that until we deal with the issue of lawsuit abuse and litigation abuse, the cost of health care will continue to remain too high.
Well, tort reform is certainly something that comes up every time this bill is discussed, and the President addressed it in his State of the Union message the other day. How much of what he said do you believe?
Well, there's the use of, you can talk about a lawsuit abuse reform, and then you've got to see what's in the details. To me, the best way to approach it, and that doesn't mean others are wrong, but in my mind, the best way to approach it is at the state level. And what I think the federal government can do through, creating incentives like maybe block grant funding or Medicaid dollars is incentivize states to take on the issue of tort reform themselves.
Yeah.
Because I think that's the best place where states can deal with it. We in Florida, when I was in the legislature, tried to deal with it, could never get the state senate to go along with it, but I always tried to get them to do that. But people again have to understand, why does this increase the cost of health care? Well, because It's harder for first of all, less people are going into high-risk specialties because they're afraid to get sued. Secondly, it's almost impossible for certain doctors like OB/GYNs to even get malpractice insurance coverage, and those that do have it, they have to pass it on to their patients in some form or fashion. So it's also leading to overutilization. Doctors are basically ordering every test they can get their hands on because they're afraid that they'll get sued if they don't. So
yeah, they're
won't go wrong.
They're in CYA mode most of the time in that regard.
Yeah, not just the doctor, but the hospitals and virtually everybody else who's touching the patient.
Well, there's another negative aspect of this too, and that is that you have doctors leaving the profession in some surprising numbers. My own physician announced 4 months ago that he was not only not going to be my doctor anymore, he was getting out of the business and going into financial planning. So you're seeing that happen as well because they just can't bear what they see as an unbearable burden going forward.
And let's be clear. There is such a thing as medical malpractice, and if someone is a victim of medical malpractice, they deserve to be compensated for their economic loss, meaning the fact they can't work anymore and whatever losses they have economically, and they deserve, within reason, to be compensated for pain and suffering. What we can't have is this abuse of the system where basically the pain and suffering aspect of it is so open-ended that you're creating this cottage industry of people that are just filing lawsuits because they know that it's going to cost the doctor more money to fight it than it is to simply settle it.
I've had a bunch of emails from people asking me to ask you this. Tell me what you think of your reception in Washington, D.C. Some people view you as an up-and-coming candidate for president or vice president. How are you taking that?
Well, I don't. Today, that's just stuff media people talk about, and it'll be me. Tomorrow it'll be somebody else. But that's just stuff that comes and goes. I mean, I'm the senator. I ran to be a United States senator from Florida because I love our state, I love our country, and I wanted to come up here and serve for a period of time. I don't plan to do this for 30 years. I want to do this for a while and then go back home and help raise my family and live under the laws I help pass or repeal. And to me, it's a great honor. I mean, it's a tremendous honor and privilege to serve in the U.S. Senate from what I think is perhaps the best state in the country to live in. And if anyone has any doubt about that, when I sit with my colleagues and they all talk about going home to ice and snow, I tell them I'm going home to 85-degree weather, and it's in February.
Rough duty. Speaking of rough duty, you spent a few days in Afghanistan recently. Tell us about that trip.
3 things I'd tell you about Afghanistan. The first is that we have a new greatest generation, and it is the young men and women of our armed forces that are serving in the battlefield, both in Iraq and Afghanistan. These are some of the most superb. You hear that from people, but when you meet them, shake their hand, and look them in the eye, it just blows you away at how incredible and how blessed we are as a country to have young men and women of that caliber serving. I'm convinced that we have the right person in charge in General Petraeus. I'm convinced that he has the right plan. And I'm convinced that we're making significant and important progress. And, when people talk about the war effort in Afghanistan, they say, well, we've been there 9 years. Well, the truth is that this effort that we're involved in now has only been around for a year and a half, and it is working. Now, here's what we need to be clear about our expectations. Afghanistan is not going to become, Canada anytime soon. I mean, it has significant challenges ahead. But what we are providing in Afghanistan is security, and that security is allowing Afghans to create institutions for themselves that will ultimately be there and permanent and provide some level of stability, enough stability so the Taliban can't return. And we know that that's what they want to do. The Taliban wants to return, and if they return and take control of the country, it'll once again be a safe haven for Al-Qaeda. So that's the role we're playing in security. There is success. There's still a long ways to go, but I believe we're going to be successful.
Well, an area that almost never gets talked about, though, is the poppy trade over there. This is fueling Al-Qaeda, and unfortunately, much of that turns into drugs which are being sold on the streets of the United States. Why is it that we are not making a concerted effort to try to wipe out the poppy fields in Afghanistan?
Well, we are, but I mean, if you just wipe off the fields and don't replace them, then you're impoverishing people, and they hate you. They're going to end up disliking you. So there are. We saw the programs. There are significant AID programs that the United States is funding to create replacement crops, like wheat, for example. At one point last year, the price of wheat in that area was worth as much as the poppy was, because now poppy has some inherent advantages. It's non-perishable. It doesn't rot, so you can store it and hold it for long periods of time. Food, you have to be able to transport it, and I can tell you that the roads in Afghanistan and the transportation system is not 20th century, much less 21st. So they have challenges with that. It's also profitability. I mean, quite frankly, most of these crops, like pomegranates, just don't make as much money as poppy does. But I think there are good efforts being made in that regard, and progress being made in that regard, and that's again, it's part of creating or helping the providing security so the Afghan people can create for themselves a functional state, a place where disputes can be resolved, where there is government that does basic services, where there are schools that kids are attending, and there's progress being made in that regard, and we need to point that out because it's true.
I'm completely out of time here, but I do want to remind everybody you're going to be at the Naples Area Board of Realtors office tomorrow for coffee with your constituents. What time does that start?
I think it starts at 2 o'clock tomorrow, and we're looking forward to seeing everybody there. It's our first event back in the state of this caliber, and a first kind of town hall open session since my election in November, and we picked Southwest Florida for a lot of different reasons, primarily because if I do it 3 months from now, half the people will be gone. So,
good point. You go where the people are. Senator Marco Rubio, pleasure. I look forward to many more conversations with you. Thanks again.
Thank you.